Hello everyone, myself Dr. Rahul Yadav, postgraduate trainee at Choudhury Eye Hospital and Research Center, Silchar. I am here today with Dr. Haimanti Choudhury, consultant Choudhury Eye Hospital. She is a phacosurgeon and oculoplasty surgeon. We will be having a one-on-one conversation with ma'am about recently it is very common called as eye flu or red eye. So, ma'am, many people are hearing this term eye flu. What is it?
Hello, Dr. Rahul. Yes, eye flu is something that people are commonly telling. Earlier, they used to say it as conjunctivitis, and conjunctivitis is the actual term which is correct. So nowadays there is kind of a epidemic going on because almost every day in the hospital we are getting around 3 to 4 or sometimes even more cases of epidemic conjunctivitis. So there are so many things that the people should know about it. So we will definitely go into the some minor details of this disease.
So, ma'am, I have this question that how this infection spreads so fast? Can it spread through the air or just by looking at someone in someone's eye? Because this is a very common myth between people that don't look at a person with the infection. You might also catch the infection. So, what you want to say about it, ma'am?
This is very true. We are here to bust all these myths. So this is absolutely false that you get the infection simply by looking at an infected person. That is not correct. The infection actually commonly travels in the air because this is a viral conjunctivitis. Of course, conjunctivitis can be caused by other bacteria also, but the common one, which is doing the rounds in our hospital and people are getting infected, that is a viral conjunctivitis, and commonly it travels in the air. You are right in telling that. Now, but there are something also which, how, like in one family, how mom is getting affected, then her two kids, and then her husband, then her mother-in-law. Like it is kind of a cycle going on. So what happens is when somebody is in contact with a person having the infection, and suppose if the person has touched a surface or the person has used a particular something, a handkerchief, and another person is using the same thing, the water from the infected patient's eye, that water is actually containing the organism. And also some organisms are airborne, so via air also the patient can get infected. But the most careful thing is you should not touch your eyes with your hand. That is the best thing to avoid conjunctivitis. Do not rub your eyes with your hands. Do not touch your eyes with your hands. Like if you have to touch your eyes, please hand wash it with soap and water.
What is the earliest sign that he has got the infection? How he is going to know about it?
Suddenly, one fine day, what will happen if you are the patient? Then, one fine day, you get up in the morning and you see that your eyes are quite red and your lids are stuck together, like you are having difficulty in opening the lids. And your eyes are filled with discharge, redness, watering. These three are the very common thing: redness, watering, and very much sticky discharge. So, when usually it starts in one eye, but then the next morning you can catch it in the other eye. So bilateral infection is very, very common. So immediately the patient has to see a eye surgeon or an eye specialist. This is very important. Please do not go to the nearest pharmacy that you get, and do not take over the counter medication, because the pharmacy people will invariably give you some steroid, and steroid is dangerous in conjunctivitis. So please see a eye doctor when you get these symptoms.
That when is the time that the person should consider going to a eye specialist rather than treating himself or herself by the home remedies?
Dr. Rahul, home remedies actually is restricted to keeping your eyes clean, which is very important. That can be done. Now, how to keep your eyes clean again? Now there are, of course, pharmacologically available eyelid wipes. They can use, the patients can use the wipes. Otherwise, you can just use clean cotton cloth, that is also fine. You can use a cotton cloth to clean your discharge that keeps on coming. But only thing is, if your one eye is affected and you are cleaning with a particular handkerchief, you do not use that handkerchief for the good eye, because that handkerchief will become the transfer of infection from your one eye to another. And another thing would be, other than this, keeping your eyes clean, no other home remedy, like please do not put any gulab gel or anything. I have heard patients talking of that. I can tell the name of one or two antibiotics which can be given, and maybe a lubricating eye drop. Antibiotics, as in you can use moxifloxacin eye drop, which come with the brand name of Milflox or Moxicip or Mahaflox. But again, as I said, self-medication is not a very good idea. And another lubricating eye drop can be given, like Refresh Tears or Eye Mist eye drop. These are simple eye drops. These are for the soothing purpose. And the antibiotics are basically to avoid secondary infection, because as I said, this is a viral conjunctivitis, so antibiotic is not going to go and kill the organism. It will only avoid a secondary infection. So other than these two medicines, I will not recommend anything else to go and self-purchase. If you are somewhere very far away from hospital, maybe you are staying in a hostel or something, then yes, you can purchase these medicines, two medicines which I have said.
If someone is using the drops, and just suppose that it's a boy living in a hostel and his friend is also getting contaminated, so can they share the eye drops?
It is actually a very practical and logical question also, because what happens is, if you share the eye drop, there is always a chance of cross contamination. We call it cross infection or cross contamination, which travels via the nozzle of the bottle of the antibiotic eye drop bottle. The nozzle actually acts as a cross contaminant. So this is something which should not be done. Sharing is not always caring. Okay. So for that, if suppose 4 of your hostelers are affected, you can use the same drop, but it has to be 4 different vials. Like,
I want to ask you that how can someone protect himself or herself if a family member is having the infection? What are the things that he should do or he should not do?
for that, actually, the patient who is infected, he or she has to be careful, and also all the family members have to be careful. As I always tell the patient, like whoever is your caregiver, if it is the daughter or the son, the mother will be the caregiver. So I tell the mother, whenever you are putting eye drops for your kid, you always have to wash your hands. And the next question which comes is, they will tell, can we use sanitizer? So I would say no, do not use sanitizer, wash with soap and water. That is the best way to kill the germs. So do that, do the frequent hand washing. And another, as I have already mentioned, is you have to tell the person who is not infected, ki just don't put your hands in your eyes whenever and wherever. If you have to clean your eyes in the morning or maybe in the afternoon, please wash your hand prior to touching your eyes. This is one. And again, the patient has to be more careful that they cannot do any sharing of towel, then handkerchief. Even I also tell to the patients, pillow cover, bed sheet, these should not be shared. And of course, no putting off for all the lovely ladies out there, no putting off eye makeup. When you are infected, do not put eye makeup, because you are making the kajal or the liner tip that is getting infected. And if somebody else is again putting that again becomes a reason of cross infection.
Someone has got the infection. Now, can he get a leave from his job or his school? And if he can get the leave or break from his job, then for how many days he should ask for it, or he should be allowed?
As for children going to school, it is definitely recommended that they should take a break of at least 2 weeks. But again, parents will tell, oh God, 2 weeks of missing classes. So at least 7 days is the minimum which the parents should do. And I have also seen school teachers and principal, they're alert. Sometimes if a kid with red eye goes to school, they usually send back. They call the parents and they send back, telling that your kid has got eye flu, which is good. This is very appreciable in with respect to the teachers and principal. But as parents, we should be responsible parents and not send our children to school for at least 1 week. That is minimum, and if possible, or if the infection is too much, then maybe 2 weeks also. As for office goers, of course 2 weeks may be kind of challenging, because always my patients tell me, my god, I'm not getting a leave for 14 days. So a 7 days break from office will be great. And if you want to do work from home, that is absolutely fine. You can do the work, but then if your both eyes are affected, you will have difficulty looking at the screen for a long time. This is a matter actually which has to be considered.
What about the vision? How is this eye flu going to affect the vision of the patient?
In the first week, in the initial week, vision usually is not affected. Of course, patient has some blurriness because his eyes are kind of filled with discharge and it is watery. So because of that, he might be having some blurry vision. But then nowadays, because I said it is viral conjunctivitis, so sometimes the infection from the conjunctiva comes to the cornea. And when the infection comes to the cornea, the vision tends to be lowered, which happens in the second week. So eye flu or conjunctivitis patient, you must have noted in your previous years that we always call the patient after 7 days. A review after 7 days is a must. Then after the first review, we assess the corneal health. If everything is fine, then maybe we can call after another 14 days. But if then the corneal health is affected, then we have to again call after another 7 days. And then the treatment can also little bit change.
What are the top 3 tips that you would like to give to the public to aware them how they can prevent themselves not to get affected?
Tips to the public would be, of course, hygiene is very important. Please maintain your eye hygiene. Along with that, hand hygiene is also very important. If you are infected, then you have to maintain hand hygiene. Do not touch like door handles and things like that. If you touch, those surfaces has to be cleaned. This is an important thing. And as sharing, as I have said, you have to have your own set of things like towels and handkerchief. Do not do any sharing. And finally, if you have got red eye, do not worry. You will be getting better in maybe 7 or 14 days time. Yes, sometimes it can take 21 days also, but you will definitely get better. Please go and see your eye doctor and do not self-treat. That will be my mantra to all the patients out there and all the people who are not patients yet. Thank you very much for this conversation, and I'll be back again with new content. Thank you so much.